Good morning, good afternoon. We very warm welcome you to today's session. So I will start by introducing the speaker for today, Dr. Jabeen Fayyaz. So I will start by saying or sharing with you a quote from Pearl. The quote is, "The test of a civilization is in the way it cares for its children." And the children in emergency, that is the passion for Dr. Jabeen. So it's my great honor to introduce Dr. Jabeen Fayyaz, an extraordinary leader, innovator, and educator in the field of pediatric emergency medicine. She is an associate professor of pediatrics at the University of Toronto and serves as a pediatric emergency medicine physician at the Hospital for Sick Children, SickKids. At SimKIDS, she directs the SimKIDS simulation program, the Teaching Scholars program, and co directs the PEM International Clinical Fellowship initiatives that have shaped the future of simulation based learning for healthcare professionals worldwide. Within over just 15 years of experience, across Pakistan, Oman, and Canada, Dr. Fayaz has earned international recognition for her visionary leadership in pediatric emergency medicine and simulation based education. Her work has advanced faculty development, interprofessional training, and culturally responsive debriefing, while her research continues to break new grounds in translational simulation, resuscitation science, and system wide improvement. Currently serving as the president elect of the International Pediatric Simulation Society, Dr. Fayaz continues to drive global initiatives that leverage simulation as a powerful tool to improve healthcare quality, equity, and patient outcome. So, the to borrow the word of Albert Einstein, education is not the learning of facts, but the training of the mind to think. So, Dr. Jabeen has embodied this principle, ensuring that healthcare providers across the globe not only learn, but learn to save lives with confidence and skills. And another quote is, "If you are always trying to be normal, you will never know how amazing you can be." So, Dr. Jabeen has not only chosen to be amazing herself, but she has also empowered countless others to realize their potential in moments where it matters most, the emergency room. So, she is here to share her experience and her vision and the practices. So I was just talking to her and I was sharing now, being in Pakistan or in North America, there is no difference. You people are with us all the time, enjoying the latest practices, latest breakthrough in the medicine. So very warm welcome and over to you, Dr. Jabi.
Thank you so much, Dr. Uzair, for such a kind introduction, and I'm really humbled. Thank you for all the participants who have joined. And I have another screen on the side, and I will be looking into the comments by everyone. Thank you for your introductions, and I'm so glad to see that how many people from different parts of Pakistan, but also outside Pakistan, have joined. And today, what I will be talking a little bit of experience in the last 2 years that we have gained about gamified learning and especially using it into PEDS and pediatric emergency medicine. So the focus of our today's presentations cover gamification, what it is an impact on learning, and other topics that I would be covering will be escape room and virtual simulation, and I will be providing you some examples for you to look at it. You can see in these three pictures, this is where my everyday work is. The building is my sim center in this building. This is the pictures of two pictures of some of my co-workers and colleagues which I work with, and a lot of work I would like to acknowledge. It is the product of a teamwork that we all do together. So I want to acknowledge all my SimKids Sim team, my SimKids SPAM team, and many other which may I have not mentioned, and without them I may not be able to achieve all this. Some of my disclosures and associations. And with that, I would start my presentation with the context. And I love storytelling in medical education specifically. So, what I would say that whoever works in healthcare, especially the fields like acute care field, like EDs, PICU, NICU, I would say in this kiosk, like where we work in, think of, especially in the emergency department, think of a pediatric trauma case which arrives at night, multiple injuries, a distressed family, and a clock is ticking. You know that the stakes are high here. It's a high pressure moment, and the success of this situation, like the success is to save a life in this high pressured moment, and it only depend not only on your knowledge, but also how would you communicate, how what decisions you will make in that moment, and how you are working as a team under this extreme stress. So think about this context that you are in the night shift, you are in an emergency department, a trauma patient, which is a pediatric child who come in, and then you have to save him based in whatever resources are available. So what happened traditionally? If I think of my how I'm being educated, my med school, my later on environment. So we have been trained for these exact moments to take care that are often not representing the chaos. We were told to go through lectures, read textbooks, or maybe if we are lucky to get some simulations just to practice IV line, or more traditionally practice on actual patient. Those all are very very useful, and that what make us where we are. But if we think about it now, reflecting back, they feel disconnected from the fast paced high risk situation that we face in real emergencies. There's no education about teamwork, there's no consideration about learners engagement, there's no consideration about how much we are getting out of it in addition to our knowledge. So if you think of now, simulation has introduced moments where you can mimic the real time chaos, and you can mimic the real time case scenarios and provide you opportunities to practice multiple time in that way that you will turn your clinical knowledge, you be novice, into mastery learning, that you are able to say that I have mastered this competence before even going to practice or before going to your actual patient. So you feel confident, you are not cognitively overload what to do, because you are being given tools in addition to the clinical knowledge by practicing the similar kind of stress, similar kind of situation in simulation. But as we are progressing, this is a unique era where our lot of generation is Gen Z generation. This is not enough for them. They will still feel like you can imagine they are immersed in this virtual reality games, they are immersed into high technology ways of learning. So they still do not feel it enough. So what I would say that in this era of technology and innovation, Uh, Training is not just about learning theory, learning about clinical knowledge only. It's about having the same sense of urgency by having high stake moments, by having the same adrenaline rush, urgency, teamwork to give them a real experience. This is where the power of gamified training comes in. Gamified learning through innovative techniques like escape room, like virtual gaming simulation, where you can not only mimic the intensity of the real world, but also mimic the technological drive or satisfaction of these learner, and then in a very fun way you can push them to think uh, and think to be on their feet, to make quick decision and work together. So, what is unique in pediatric emergency medicine? And I'm taking an example of pediatric emergency medicine because of my background, but this will apply to many, many specialties in healthcare. If I think of pediatric emergency medicine training as a unique opportunity, it is because, unlike any other field in healthcare, you are not only fast paced, high pressures, but you will also demand both clinical expertise and emotional intelligence as a healthcare provider. So what you will see that this is the chaos you will see in the emergency department. Traditional methods sometimes often fail to provide adequate exposure to these complex scenarios. They will tell you what is the management of septic shock, what is the septic shock algorithm. But when it comes to actual environment, the patient does not come with the label of septic shock. It comes mimicking many other scenarios, and in that you have to identify that. And then that's not the only patient which is present in the emergency department. So you have to manage them with many, many other acute care situations. Then, in addition to that, you are also not only managing the patient, but also the families and environment. And that's how it become very, very unique challenge for physicians who are working in this acute care specialties, that how to work with the families, how to work with the multidisciplinary team. So therefore, one of the solution, I'm not saying this is the only solution, but one of the solution comes up as gamification. Gamification refers to the application of game design elements like points, levels, challenges, competitions, and rewards into non-game context, that is healthcare education. In simulation-based learning, this approach help increase motivation, help increase engagement, and then also the retention of the clinical knowledge and skills. So gamification application, like for example, if you ask the participant that they will earn points or unlock level based on their decision, that will boost their engagement and they boost their skills and development and team collaboration. And then you will ask me this question: why gamify? As I have given a little bit of context, today's learners are increasingly drawn to interactive, hands on learning experiences rather than traditional ways. And even I would say traditional simulations are not only now enough to keep them engaged. So, gamification taps into this preference by offering a more engaging participatory approach. By creating a safe yet competitive environment, gamification support experiential learning where learner can practice, make mistake, and improve without any real-time consequences. So there are many, many educational theories that you will find behind the gamification, but my most favorite one is the Kolb's experiential learning cycle, which I would like it because it provides you a full circle. Let me tell you how. If you focus on concrete experience in this arm, the gamified learning immerse learners in realistic clinical scenarios, offering them the chance to experience real world challenges in a safe environment. Then the second component is the reflective observation. After the immersive experience, learners reflect on their action and decisions. In a gamified setting, this often takes place during the debriefing, which happens either in between or after the simulation, where participants evaluate their performance and the outcome of their choices, whether they are able to unlock the puzzle, whether they are able to achieve the code correct or not, and then there's a discussion followed by abstract conceptualization, which is a stage that involves connecting the hands-on experience to clinical principles, helping the learner understand why certain action lead to specific result. And gamification reinforces this by allowing learner to tie their action back to medical knowledge and theory, followed by active experimentation, where finally learners apply their newly found insight to subsequent challenges, constantly refining their approaches, and then this iterative cycle will continue to go and it will build over each other. If you go, you are asking what is the literature. I have told you what my preference is, but now start looking at the literature about gamification. Just when I was preparing about this presentation, I searched gamification and it was in the last 5 years. So I got 34,800 results. Among them in 2025, there were almost 7,600 results. So it's not that it is very, very new and novice. There is a lot of literature available around it. And what this is the recent article and why I'm mentioning, I did it myself with a couple of my colleagues from North America and Jamaica, where we write this special issue article about gamification, serious games and simulation. And this, we find out that research support the use of gamification in healthcare education, demonstrating that it's effective in enhancing the engagement and improving the knowledge, skills, and decision making. By integrating the game elements into the learning, gamification not only motivates learners but also encourage their active participation that will result into more deeper retention. But the important fact here is we have to implement it thoughtfully to avoid potential downsides. That is unhealthy competition. As it is a competition, so those who are losing, what are the consequences they are facing and how they are feeling among their peers. So this is an important element that you have to consider. So this article highlights the value of gamification, serious games and simulation, but also help you understand that how can you apply these principles in the way that can optimize learning in a safe and engaging environment. And during the search, I come up across this article, which is kind of it's not a article, it's a 2014 research letter, which is published by a surgeon, Carfoot and Kisane. And I was very much intrigued seeing this research. First of all, it is as early as 2014, and what they have shown or they have put it into writing is that deliberate practice is crucial for maintaining surgical skill. But we all know that it's a challenge to ensure consistent engagement in simulation training. Even a 2 week gap in practice can lead to noticeable decline in skills. So what they have shown is the examination of the impact of gamification on enhancing resident engagement in simulation training. And they will define that if you see in the graph and this blue line that how introducing gamification into their training program boosts the engagement in surgical simulation training. The data reveal a striking increase in simulator used after the announcement of a tournament, with participation rates rising significantly. You can see before the announcement and after the announcement, which is this blue dotted line. In just a few weeks, residents engage in far more sessions and exercises, showcasing that how gamification can transform training habits, leading to improved skill retention and consistency in practice. Then you will see a lots and lots of literature from healthcare professionals, from nursing literature, that how in comparison to traditional medical education, the gamification is not only revolutionizing the methods of training, but also it enhances the engagement, the retention, also the clinical reasoning, if you look at various of those articles. But yes, they are mostly either review article or maybe like a descriptive studies. And this allude to that there is further research in this area is very much needed to do randomized control trials, or maybe a more comparative analysis in comparison to the traditional methods, that what aspects of gamification is providing more benefit than the traditional methods of education. With this preamble about the gamification, I would like to talk about now two aspects of gamification. One is the escape room, and the second that will come up later in my presentation about virtual gaming simulation. So, what are escape rooms? Escape rooms are the areas, or are the rooms that are defined or developed for the participant, where they are challenged to unlock various mysteries by solving puzzles and applying critical thinking in a fast-paced, engaging environment. Just like mimicking in the real life, when you're providing clinical care, clock is ticking and each decision can unlock new clues or reveal a critical information about a patient, which will help you to advance. In this way, the escape room, you will solve puzzle, which will give you more information, and you will then uncover the mystery. But here the mystery is the medical mystery. So if you look at the healthcare escape rooms, healthcare escape room is a physical adventure game where participants work together to solve puzzles within a set time limit to achieve a specific goal, such as escaping a locked room or solving a mystery. Here you need three things: a game master role. The game begins with the game master explaining the rules, safety instruction, and the game's objective. Like you have a facilitator to facilitate a session, a teacher to facilitate a classroom. Similarly, you need to have a game master role. They also introduce a background story to engage the participant, which is in the healthcare escape rooms. That story is a scenario or a case scenario. The second important rule or element of a escape room is gameplay mechanics. The players enters a locked room, and that locked room can be a locked box, can be a puzzle to solve, which I will show you some examples, or maybe coming out of the whole room. It could be anything. So with, as I said, they must work as a team, searching for objects and solving challenges, with the game master observing and providing hints as or if necessary. And then at the end, it is followed by the game conclusion, where the game concluded when the group either complete the goal before the timers run out or reaches the objective sets by the game. This could vary depending on the theme of the escape room. And healthcare context, this immersive time-bound challenge mirrors real-world time pressure situation. For example, if you have to follow an algorithmic approach on a cardiac arrest, then CPR, which is timer, you have to identify that it is a cardiac arrest and start CPR, and no more pauses than 10 seconds in between the pulse check. So this is what is to give you a situation where it is time bound, time pressured, making it as an effective and engaging way to train the healthcare teams in high stake environment. And as from the literature, I have shown you a couple of the examples. Even in the emergency medicine, it has shown to improve the clinical reasoning. It will help in building a team, which is collaboration is the key in healthcare. We cannot work alone. We have to work with nurses, with the respiratory therapists, with social worker, among even in the healthcare, like in the MD group, you have to work with staff has to work with fellow or residents or medical students, and then other specialties, as I was giving in a context of trauma with the neurosurgeons, with the general surgeons, with the orthopedic surgeons. And then in addition to the team building, it will create memorable learning experiences, reinforcing medical knowledge in an engaging and interactive way. So how does it work? Like if you look at the whole context, you have to have like a space where they will be stepping into a fully equipped medical setting with realistic props and equipment. Then they immerse themselves in a clinical environment like a scenario, and then they will assess the patient scenario, solve the medical puzzles using their clinical knowledge, and then beat the clock to save the patient. So this is the whole steps of escape rooms, and the escape room provide not only accessibility but also flexibility, can be provided in both digital and physical formats. I have colleagues known who have developed escape rooms on Google Documents as well, where you can give it to their learners and learner will solve in sitting in the Zoom and working together. It will immerse the learner into authentic clinical scenarios which appear real and which appear engaging. And then it is very much visually rich by incorporating picture-based puzzles, text-based challenges that will give you more learning opportunities for the learners who can be a different form of learner. You may have a group of class who are more visual learners or auditory learners or learners who learn by performing things, so that in that way you will cater all the types of learner. And if you look at the various success stories into the literature and based on our own experience, it lead to 40% increased into team communication, increasing in the confidence of the learner, and then almost 90% plus participant satisfaction. So let's give you some of the example. This is one of the example of the escape room, which is created for proper donning and doffing at SimKIDS, and the credit goes to all the IPAC, which is infection control team, who have developed this escape room. And you are seeing the paper blueprint of these escape room when you are seeing a lot of arrows and it's going down. And this escape room objective is to simulate the critical task of cleaning the equipment between patient bed pits, and also donning and doffing proper PPA equipment. So with this is like here, I will show you these two puzzles later on. I have details in the slide, but we have Kid Health Alliance where we work in the community and create these escape rooms and puzzles. So here, this is an example of one aspect of the puzzle where the escape room is designed to demonstrate the management of pediatric diabetic ketoacidosis, and the objective is to simulate the critical task of calculating and administering the correct bolus dose of fluid for the patient and DKA. So what happened, the puzzle is participant has to first calculate the correct bolus dose using a saline bag and syringe. They then need to fill an opaque reservoir with fluid, and this was the opaque reservoir. Once the reservoir is filled, a ball floats to the top, revealing the additional vital sign information that will help guide the next step in the patient care. So you can imagine with simple opaque bottles and with the golf ball, a puzzle has been created. When they fill the bottle with the right amount of fluid, then it will reveal a puzzle or puzzle that will give you more vital signs, and that's how the scenario will progress. Then the other examples which I was showing in you in my last couple of slides, in this escape room scenario, the objective is to demonstrate the current sequence for donning personal protective equipment, a critical skill we all know in infection control, and COVID make it very, very explicit how important this skill is. The puzzle is the participants are given a set of PPE items and they must arrange them in a correct order. The challenge is that a lockbox remain locked until they correctly sequence the item, just like following the proper protocol in real world healthcare setting. And once all those items were placed or arranged correctly, the lockbox opened, revealing the next clue to the task. So you can imagine you can teach them by a lecture, by a demonstration, but then this is another cool way of engaging them and incorporating how to convert this boring learning about donning and doffing into a fun, interactive way by incorporating gamified learning principles. And this interactive hands-on approach allows the participant to practice PPE, donning in a controlled yet engaging environment. And if you look at the feedback of these small changes that we have done, you can see the huge difference from the pre-test up till post-test, and a lot of positive feedback that about that activities, that they do not only worked as a team, they communicated, but also able to learn in a fun way. And then now we are in the process of estimating their long-term retention, that whether they have a more long-term retention or not. And that's what where we are also based on this very good experience of our donning and doffing simple escape rooms. Now we are developing an immersive escape room for PEM safety and quality issues that we are identifying in our emergency department. And that is it's still work in progress, and I wish I'm pretty hopeful once all the study is done, I'm able to come and present the component or composition of that escape room and the results that we get out of that escape room. So this is a little bit about the escape rooms, and I will pivot to my next portion, which is about AI-driven virtual simulation gaming scenarios, where you can incorporate them as a pre-learning for the learners. And we have there are two ways, think about it, that learners are coming unprepared to these sessions, and these sessions can only be an hour long with so many resources: sim center space, sim educators, sim specialists. So how can you utilize this hour in the most engaging way? So you can give them some pre-learning so they will come prepared. You do not want to convert a session into a lecturing session. We are where you are just telling them how what is a sepsis, what is septic shock, what is the septic shock algorithm. Rather, you make sure that they come prepared knowing all the knowledge, and now they are coming to perform it with their teams. And one way of delivering that pre-learning is about by doing virtual gaming simulation. So the platform which we are using at SimKIDS as well as at Indus Hospital Health Network is Affinity Learning. I do not have any financial affiliation with them. We are using it and we really like this platform. This is the QR code if you want to go to that platform. And it is like if you want to look at a real world example, this is the platform which we found it most useful working with them. It is designed to provide a fully integrated learning experiences that engages students, and also the educators and students can access a range of interactive tools, track the progress, receive feedback, all within one easy to navigate platform. And the goal is to make learning not only effective but also enjoyable and accessible to all participants. You can access it through your mobile phone, through your iPad, and through your laptop. So let's look at some of the features. This is, like you can see some of the example, it will provide an interactive learning experience by intuitive authoring. And as I said, it is mobile friendly. Here you can see the example of the decision branching. You can make it as creative, like for example, you have a set action, and then the learner can take two actions, either can apply oxygen or can call the RT, and based on their action they can go toward one pathway versus the other pathway. I'm going to demonstrate those platforms to you so you will be able to understand it further. So it also have an responsive vital signs simulator where you can incorporate the simulated vital signs, and you can see in this example they have to choose, the scenario is about low saturation, and they have to choose the method of applying oxygen, and based on their answer the oxygen saturation on this platform will change, and there's a couple of options here as you can see. Then you can also ask them about knowledge inquiries. For example, here your task is, this is a scenario about a person who is very much agitated or is aggressive. So the scenario is choice of distance. So you can see the red cross here and the green right here, where based on their answers it will give you an immediate feedback whether it is correct or incorrect. And you can see here above they are tracking their whole total scoring into the environment, like based on how many answers are correct out of how many options they have chosen. Then it also provides you with the 2D visual interactions as well as 360-degree examples. So let's listen to this video. You can see the visual interactions by putting hotspots. You can see these blue circles and white circles. These hotspot, you can put it an audio and video as well as text, and then you can do a 360-degree videos as well. You can video record any of the environment and then put a hotspots for the learner to explore the room further. It is for a space where you really want the learner know about the equipment. So this is an example that how you can incorporate the 2D hotspots as well as the 360-degree hotspots. So you can imagine it is may not be possible to bring all your learner in the space to orient them, but then you can create such scenarios so that they know all about how the environment look like, and you can just take a 360-degree, like even a 2D, if you do not have a 360-degree cameras, like now a lot of smartphones have those capabilities, and that will suffice. In addition to that, you can provide them decision-making opportunities as well, so which allow the learner to test their clinical decision-making skills in the virtual simulated environment. The learner is presented with a scenario such as assessing a patient respiratory status, and they have to make the decision based on patient conditions. So all of the options will be right, or there will be no wrong answer, but one option they have to prioritize immediately. Like for example, in any airway management, we have to position the airway and suction the airway first. So all may have to be done, but in which order, that will really ask about the decision making skills of the learner. Then natural language conversation. It has got avatars where you can incorporate, like one way is history taking, which cannot be incorporated into virtual environment. But here you can train the models and then you can have a conversation. Here a learner is interacting with Johnny and asking them some question, and if they are right, they are starting to appear here that the learner has asked about the patient age and the level of consciousness. And then at the end, most important thing, you can integrate it into any LMS, into your existing university, hospitals, environment, and it can provide you the detailed reporting and scoring of your learners and students. A lot of places or universities in North America are using it, and these are some of the examples. If you want to access now, I will stop sharing my screen and I will tell you how to access this platform in the last few minutes so that you can be able to create some of the scenario, because they have a community page which is free for you all to access, and you can use their scenarios which are already developed on there. So let me share the screen again. So if you put in the Google affinitylearning.ca, it will take you to the Affinity Learning platform. And if you choose the community library, it will take you to the community library. It is a free one. You only have to pay the subscription if you want a dedicated page for your university. And you will see I'm scrolling very quickly just to showcase many scenarios which are already present on this platform, not only for physician, but for nursing, for paramedics, for med lab, for respiratory therapist, for even public safety and patient support workers as well. So please feel free and go there, feel free to explore these platforms. But I want to show the two which I have been, like this is the one which I have been involved with the Browns College, where we have developed a scenario for interprofessional pediatric simulation. And the second one is about the pediatric resuscitation. So let's do the pediatric resuscitation. And if you want to share it with your learners, when you open a scenario, just go to share. This is the link, copy link, and you can share that link with your learner. And I will share those links in the Zoom chat of today's session, as well as the APPNA MERIT group of WhatsApp APPNA MERIT group. So let's see that in action. I'm starting it from the beginning. So you will see in the beginning, there are some instructions, and then the universities or the institutes that have developed it, they will give you some pre-briefing in this form of instructions, and then some of the algorithms, which are you can download as a PDF version. I'm not downloading it. I'm just going into the scenario.
London calling crew 971.
This is 971. Go ahead.
971, you are responding code 4 at 101 Fanshawe College Boulevard for a child that crashed their bike and appears to not be responding.
10-4. Do you happen to know the age of the child?
Crew 971, a bystander who called it in is not sure, maybe around 6 years old.
971. 10-4. Dispatch. We are code 4 on our way.
So you have listened, and now you will put an important information, and then you will continue here. Here it will ask you a question. Based on information provided, place the following step in order. I'm just doing it quickly for the sake of time. So I chose check for the pulse. I check perform a scene survey. And then here it is asking me how I will prioritize. So I will prioritize airway, breathing, circulation, and neurological. And then I submit. Immediately I get a feedback. This approach is right. This approach is wrong. So let me recheck it, redo it as per PALS or BLS algorithm, and it given me immediately that I am right or wrong. Then the scenario will progress. And you can see here after some time a vital sign will start appearing. The EMS has arrived. I'm just forwarding it a little bit.
Come flying down on his bike and he crashed right into the wall.
Okay. I'm just gonna get his clothes off, Maddie. Okay. I'll hook up leads once you get that off. Okay. Okay.
I didn't
You'll
see
see
anyone.
the vital signs starting to appear.
Clear. Blood pressure's on. Chest is clear and equal bilaterally. You said chest and abdomen were clear? Yeah. Okay.
So you will continue, and then it will ask you further question that based on that, what actions you will do. So this is a one scenario, and let me show you another scenario that how that scenario is working, just to give you a different context. This again asks you your name. You will put your name, so that identification, then learning objectives, some acknowledgement, some pre-briefing that you always provide you in a sim scenario. Then it will tell you what you are doing, what are the things that you will be learning, and then you go there. So it's a busy emergency department where a child has come for injury.
Okay. Thanks for asking. It's busier than I imagined it'd be.
Don't worry, it'll feel like home in no time, you'll see. Feel free to ask me any questions if you have any. I'll be in here if you need anything.
Excuse me? Are you coming to see my son Simon? The nurse who brought us into the room said that someone will be along shortly, but that was ages ago. It's been a really long time.
So it will ask you, yeah, you have entered the 360-degree environment, and then click or drag the cursor, and then it asks you what are the important things you want to focus. And here they want to teach the learner about PAT.
Who are you?
My name is Danny Flores. I'm part of the team here. What's your name?
I'm Simon. Are you going to look at my knee? It got smushed.
Yeah, you can't really put any weight on it, and the coach said that these can be tricky, and someone should take a look at it. Might need an x-ray.
How did you hurt it?
So I know it is, the whole scenario is almost 45 minutes each for both, so I won't be able to go through it, but it's just to provide you some of the examples that how you can incorporate. And as I said, these are free access, so I'm going to share the link of it, and you will be able to go through it on your own time. And there are many available on the community side. We have converted all our pre-learning into virtual gaming simulation. So what it provides us, we can now even track who has completed the scenarios or pre-reading before coming. And we notice people are completing it more because it is fun way of learning something than only a PDF version of a handout that they are supposed to learn. So like we have seen those changes, and then we are getting more and more requests that how can we use affinity learning, how can we develop more scenarios using affinity learning. And then you may be wondering about these cases. So this is the first case, pediatric resuscitation. If you want to scan the barcode, I will give it a 10 seconds, keep it on there. And then the second is this one, which is the what's wrong with Simon, the asthma one. If you want to scan the barcode, it will take you directly there rather than, and you see I have copy paste the link here. So it's so simple to share. And with just one link, you can share with as many learners as you want. But yes, these technologies are never ever without challenges or limitation. You definitely have to do development investment. It will cost you upfront, but then if you are able to running it for long term, for example, initially the subscription is only for one module. Now we have almost 20 plus module, and now almost 3 to 4 departments are using in the same cost. So you can see the initial cost was high, but now we are using it more and more, the cost have gone down. Technology barrier, yes, you have a learning curve. You have to learn about the platforms, but then once you have learned and you have trained people, then it become easier. And then facilitator preparation, they need to know about it. I would say the best practices to implement them is multidisciplinary collaboration. iterative testing. The modules which we developed 4 years ago doesn't look good because we have learned how to incorporate various engagement pedagogies, and we are not only iteratively testing them, but also doing a continuous refinement, and then documentation, the implementation, documentation, the evaluatory parameters for these platforms in order to continue reinforce yourself and reinforce others. And some of the evaluation framework should be about the knowledge assessment, about the engagement, and then observation of the performance. Don't ever forget that adaptation to local context. You cannot take the same module, which is you will find in all the North American version. You have to adapt it to the local context by making it more aligned to the regional epidemiology, by like the same environment. It doesn't look like an environment where the Pakistani hospitals or physicians work. So you have to locally, if I will show you some of the modules which have been developed by Indus Hospital, is they have taken the video and the video clip of EMS bringing a child, and they have incorporated that video into their modules to provide the context, to provide the resources available, and then language and cultural context. Frankly speaking, in the affinity learning, as per the team of their technology team, you can develop in any language the affinity learning modules. So if I summarize everything what I have talked about, the gamified approaches can be used to increase learners' motivation and participation in any specialty of healthcare, but we are finding it particularly relevant for our PEM. It will provide experiential learning by active problem solving approaches, which improve knowledge retention and clinical application. It provides us implementation flexibility because we can use multiple formats, we can engage multiple types of learner, and we do have virtual platforms available now to allow adaptation to different settings and different cater the different resources which are available. But what is important is the strategic design, thoughtful development, and evaluation processes, which is essential always for the effectiveness of any educational pedagogies that you implement. So I would say the call for action is think about it now, but do not think about it as you have to do everything from the beginning. I think about learning from others' examples and integrating it today into your existing curriculum. Do it in collaboration with other institutions, so it will not be a very high or resource intense method that you are trying to incorporate, and research it afterward. So I have put it the future of PEM training, but I would say the future of the healthcare education training depends on our collective willingness to innovate, collaborate, and rigorously evaluate these new approaches. With this, thank you so much. Please follow the SimKIDS on the social media. This is the barcode of the LinkedIn page. And then if you want to follow me or ask me about all these methodologies, I know this 1 hour may not be enough to do the justice with all of this very, very heavy topics. Please reach out to me through my email or follow me on my LinkedIn page. With this, I'm glad and thanks to all of you. I think we have 78 participants who stayed there listening, and I'm happy to answer any questions that the learners have at this point.
Thank you very much, Dr. Jabeen. It looks like a science fiction rather than a simulation lab or a reality. Like, the graphics, the design, the interactivity. So you feel like you are into it. So it's a very, very tactical and strategic use of intellect into the medical education. So we have with us Professor Akhtar Hamid, who is a pediatrician and attached with the University of Toronto because both are pediatrician. So I will invite Dr. Akhtar Hamid to share his thought and what's his reaction and if there is anything he would like to highlight about the pediatric emergency medicine. And surprisingly, he's at this point in time attending an emergency. He was into it and just came out of the emergency room. So over to you, Dr. Akhtar Hamid.
Thank you, Dr. Ozair. What a wonderful talk, Dr. Jabeen. I think you have summarized there is a gamification world into, in a few lines within 40 minutes or so. I mean, as you rightly said, that there are multiple format and there's a multiple type of learners can get benefit from there. I think it's time to embrace the technology into our curriculum, and not only in emergency medicine, but I think we can also try in different specialty, including surgery, orthopedics, and I'm sure a lot of people are already, or universities are already incurring it and then using it, this method. If you remember the way we were trained, we trained on the real patients, and we perhaps caused a lot of morbidity on those real patients while we are training, even including from simple IV line and doing other stuff. But now with this simulation and these techniques and in its innovation, we are all doing on the sim and not giving any hurt or any what you call morbidity to our patient. My question to you, in terms of Pakistan, we know I'm working here, you're working here. In terms of, you mentioned about Indus Hospital as well. So in terms of Pakistan, what are the baby steps we can take or our universities can take to start implementing it in the daily curriculum of the medical students? Because these students and many of those students come to Europe and America for their training and come to work even. So what would you say to them that these are the steps one should take, and we should how to emphasize the bodies which controls the curriculum of medical school? Thank you.
Thank you, Dr. Akhtar, and that's a great question. I would say we have to anyhow embrace the technology, whether we accept it or not accept it. It is going to be the new era of learning and education. So first of all, embracing it is the most important step, followed by faculty development, having faculty buy-in and leadership buy-in into these new methodologies. I would say I have noticed a lot of fear about resources in terms of money investment. I would say with a very little retweaking of where the investments are being made, you can still incorporate these methodologies because during COVID, a lot of virtual options become very easily accessible. So I would say the biggest challenge will be accepting it, doing faculty development, and thinking about their curriculums will be the three most important steps that can be taken. And looking at the landscape of Pakistan today, I am pretty sure that the resource or investment is not in terms of like acquiring these platforms or buying something, building these platforms. It's more into acceptance and faculty development.
Thank you. You rightly said that we have to start tweaking things around. Otherwise, and if you like when you say the flood is coming, if you don't prepare for it, it has to come, and it will sweep you away. So same way, we have to start embracing the technology, and especially the listeners who is listening, if they are from universities or they are having they have faculty positions, and even the students, this is like not one person job. It has to be come as a teamwork. The students should demand, the faculty should start communicating in the strategic planning meetings, and it is us who has to direct our funding and tweaking things around. And Indus has shown a great example by using the local things without investing a lot of money into high-tech simulation. Thank you.
and they are able to get the subscription because they want an Indus page. But as I said, investment seems a little bit a lot in the beginning, but on long run, it becomes, because you can develop hundreds of scenarios. There's no limitation of how many scenarios you develop if you have even a subscription of it. But there's a community platform which is free, and anybody can use it if you are willing to share your case with others.
Over
So,
to you,
Dr.
Dr.
Jabeen,
Uzair.
yeah, there is a question from Sabah Laila Aslam that escape is a new concept. Can it be applied on resource limited setting too?
Yes, Sabah, I will share with you. I know Sabah very well. She's a dear mentee and colleague and friend. I will share with you one of the example of the escape room, which is developed on Google Documents, and it is very free. Like you can imagine Google Documents. If you have a Gmail address, you can use Google Documents. So I will share that example with you, and it is about one of the emergency scenario.
Thank you
Thank
very
you.
much, Dr. Jabeen. And I think we are very close to the finish point. So thank you very much. You are so kind, you are so generous, and you devote your time to these type of community building and knowledge building activities. You have been showing up time to time with lot of knowledge, lot of homework, and very few people really appreciate how much effort and time it requires really to prepare one talk and streamline the thing. The beauty is this: now, living in Pakistan, you have an access to the most up to date and the cutting edge technologies. So you're so lucky. It was not possible like 10, 15 years ago. And the diaspora and the professional here, they are very keen really to bridge and this gap. So extremely thankful to Dr. Jabeen for her time, for her effort, resources, and a great source of bringing the technology. Also extremely thankful to Professor Dr. Akhtar Hamid, who rushed out of his emergency, pediatric emergency. Side by side, he was sharing the parameters and joining and remain with us. And most importantly, to all of you, we are extremely thankful because no webinar is possible without the participants. So your continuous participation and your appetite to acquire more knowledge, cutting edge knowledge, is the force which is making this possible and continuing it. So this is our like sixth year in progress. So this is a very, very impressive activity going on over years, and we will continue for the new speaker and sharing new knowledge with the same speaker. So thanks you, all of you, and our technical team, the Waleed and his team. Thank you very much for your time, efforts, energies, and making it. I was saying, allow me to say the word in Urdu कि अल्लाह ताला शैतान के कान बहरे करे. अभी तक हम 5 सालों में we never failed. So that is the wish list. I'm so happy with this. Thank you to all of you. Lot of best wishes. Take care and enjoy the rest of the weekend.
Thank
Thank
you
you
so
very
much,
much,
Dr.
everyone.
Uzair, for your leadership for it. It will
Yeah,
not be able to
thank you.
happen without your leadership, without your commitment, and definitely a
Mm.
huge, huge thanks and all the appreciation go to the tech support to Waleed, who provide and who is always on it and coordinate it so well. Thank you.
Thank
Thank you.
you.
Bye.
Bye-bye. Bye.
Yeah, thank you. Assalamu alaikum. Take care.